user's number is 1. Please relax during measurement.
There are 2 types of dysmenorrhea, and each type has different causes.
Caused by, say, fibroids, for instance. So the one for fibroids, you can get the pain during the periods. Fibroids is a situation where you have a growth in the uterus. So then, in the lining walls of the uterus. So this pain will be there, but also you might find that it's associated with heavy menstrual flow. So, and then it can, the menstrual pattern can also change with spottings and on throughout the month. So that makes it now different from the primary dysmenorrhea.
Primary dysmenorrhea is the most common kind of period pain. It is period pain that is not caused by another condition. The cause is usually having too many prostaglandins, which are chemicals that your uterus makes. These chemicals make the muscles of your uterus tighten and relax, hence causing cramps.
Things that you find is people who dress tightly during periods, okay, like during menses, then I think that's not very good. As much as what causes endometriosis you may not know, but one of the things we know that cells can change at any part of the organ to be responsive to those hormones, like the one in the uterus, or if you put pressure, too much pelvic pressure, then the menses, instead of coming out, they will go backwards. Okay, they can go backwards, and when they go backwards, now they can cause endometriosis. So I would advise women out there that during your periods, also avoid to put on tight things, tight clothing. Make it free so that you allow the menses to flow out. Yeah, those kind of things can also be detrimental.
Secondary dysmenorrhea often starts later in life. It is caused by conditions that affect the uterus or other reproductive organs, such as endometriosis and uterine fibroids. This kind of pain often gets worse over time. It may begin before your menstrual cycle starts and continues after your menstrual cycle ends. Premenstrual syndrome, or PMS, is a group of symptoms that start 1 to 2 weeks before the periods. Most women have at least some symptoms of premenstrual syndromes, and the symptoms go away after their period starts. For some women, the symptoms are severe enough to interfere with their lives. They have a type of premenstrual syndrome called premenstrual dysphoric disorder. There are 2 types of dysmenorrhea. However, the common symptoms of premenstrual syndrome include joint pain, weight gain, and headaches. According to research, no one knows what causes premenstrual syndrome, but the hormonal changes triggers the symptoms. Allo Meresia for Ebru TV.